Then next question, Ria, an 18-year-old established patient, came with her mother with complaint of high-grade fever and cough. She is an autistic child and so his primary care physician collected details regarding the complaint from the mother. He diagnosed it as viral fever. So in the question, it is given clearly as Ria is an established patient that you have to note. Okay, then identify the problems. The patient's complaint is high grade fever and cough, and the physician has diagnosed it as viral fever. So, viral fever is an acute uncomplicated illness or injury. So, one acute uncomplicated illness or injury means it comes under law of a problem table. Okay, then next second data table. What all are the points you have to consider? If any tests are ordered or reviewed, or if any independent independent historian, or if the physician discussed the treatment with another physician. So, if any point is here, it is given as the physician collected the details regarding the complaint from the mother, which means this particular patient have an independent historian. Because the patient is an autistic child, the full history is not given by the patient, it is given by the mother. Okay, so this comes under category 1 of law. Category 2 of law, independent historian. Category 2 of law. Okay, so to consider law in data table, either category 1 or category 2 have to satisfy. So here the category 2 is satisfied. So in the data table you can take it as law. Okay, so in the problem table also low, data table also low, which means the final MDM level is low. Okay, so MDM level low of an established patient, the code is 99213. Then next 17th question. Patient is a 35-year-old male who presents to emergency department. Okay, so here it is again an emergency department question. With symptoms of low back pain and mild nausea, ED physician performs a medically appropriate history and examination. Urine analysis and CT of the abdomen is ordered. Result of the CT shows 2 small kidney stones. ED physician discuss the results with the patient and tell him that the stones are small and will pass on thereon. Patient is being discharged with a prescription of over-the-counter pain medication. Final diagnosis is kidney stones. Okay, so here again the whole process took place in emergency department, that you have to keep in your mind. So you have to take quote from that section, emergency department. Now you identify the MDM level. So what all are the complaints? Low back pain, mild nausea. And what is the reason for low back pain and mild nausea? 2 small kidney stones. Okay, so this low back pain and mild nausea are some small minor problems only. Moving on to the final diagnosis, the 2 small kidney stone. It is clearly telling that the stones are small, so small that it will pass thereon through urine. Okay, so it is not a big problem. Okay, so it is again a uncomplicated condition. Okay, so in the problem table we can take it as low because the patient is having 2 minor problem or 1 acute uncomplicated condition, means you can take it as low. Okay, then the second one, data table. 2 tests have ordered. One is urine analysis and other one is CT of abdomen. Urine analysis and CT of abdomen is ordered, means 2 tests are ordered, which comes under category 1 of low. Okay, category 1 of low is satisfied because 2 tests are ordered. So the problem table you got low, data table you got low, and in the risk table, OTC, over the counter pain medication, means it again comes under low. So the final MDM is low level from emergency department. So the code is 99283. Then 18th question. Matthew, a 62-year-old established patient, came to cardiologist with a complaint of difficulty breathing and chest pain during physical exertion. Cardiologist ordered echo, CPK, TROPT and PFT. After interpreting the results and discussing PFT results with the pulmonologist, he concluded it as coronary artery disease with angina pectoris. Report the E&M service of the cardiologist. Okay, so this Matthew, a 62-year-old man, is an established patient. He came to a cardiologist, and what all are his complaints? Difficult breathing, chest pain during physical exertion. Okay, then after ordering a series of tests and interpreting the result, the final conclusion is it is CAD, coronary artery disease with the angina pectoris. Okay, so difficult breathing, chest pain during physical exertion are some minor problem, but coronary artery disease with angina pectoris is a condition which is threatening to life or bodily function. It is a chronic condition with a threatening to life or a bodily function. So go to the problem table and identify that particular condition comes under which category. Okay, one acute or chronic condition that is threatening to life or bodily function comes under high. Okay, so in the problem table you get high. Then go to the data table. What all tests performed? Four tests are mentioned: echo, CPK, TROPT, and pulmonary function test. So four tests means category 1 of moderate and high is satisfied. And one more additional point is discussing pulmonary function test result with the pulmonologist. So discussing the test result or management with another physician comes under category 3 of moderate as well as high. Okay, so you have to take moderate or high. If one of the three categories are satisfied means you can take it as moderate. If two or more of the three categories are satisfied means you can take it as high. Since here two of the three categories are satisfied, you can take the data table as high. So the problem table is also high, data table is also high. So the final conclusion is high level of MDM with an established patient means 99215. Next question. Joseph, a 62-year-old established patient, presents to his primary care physician, Dr. Smith's office with complaint of a sudden strong desire to urinate, frequent urination, frequent awakening at night to urinate. Physician test for a PSA blood test and urinary flow test. After examination of test, physician documented the diagnosis as benign prostatic hyperplasia. So this established patient of 62 years old came with many complaints, that is many minor problems. So, sudden strong desire to urinate, then frequent urination, then nocturia are some minor problems, right? And after ordering the test and their interpretation, the physician has given a diagnosis, that is BPH, benign prostatic hyperplasia. Okay, so first you have to identify what all are the problems and it comes under which section of problem table. So benign prostatic hyperplasia is a stable chronic illness. When I have already explained the problem table, I have explained you what is stable chronic illness, what all are their example. In there I have already mentioned about BPH and acute cystitis, urinary tract infection, everything I have mentioned there. Okay, so at least you study that those conditions comes under which category. Okay, so this BPH or benign prostatic hyperplasia is a stable chronic illness, so it comes under low. Then next data table, you identify the tests ordered or reviewed, etc. So here PSA blood test and urinary flow test means two tests. Okay, two tests are ordered, which comes under category 1 of low is satisfied. So in the data table also low is satisfied, problem table also low is satisfied, and the patient is an established patient means established patient of low MDM. The code is 99213. I'm going a little faster because now we have already seen so many questions and you have already gained the knowledge of how to take the code for this. So that's why I'm going little faster. Then 20, Lucy, a 42-year-old lady, come to visit physician in office with complaint of pain in the left breast. The patient is having a chief complaint of pain in the left breast. Physician examined her breast and palpated a lump in left breast. He ordered for a breast ultrasonography and prescribed medication. How do you code this office visit based on MDM? Okay, so what is the problem? The main chief complaint was a pain in the left breast, and the physician has concluded it as a lump in the left breast. Okay, so the lump in the left breast is just a differential diagnosis. Okay, which means that lump can be a tumor, it can be a cyst, it can be something. Okay, the final diagnosis is not clear. The final diagnosis will be clear only after the result of breast USG is viewed. Lump in left breast comes under which category? It comes under one undiagnosed new problem with the uncertain prognosis. There is one category like that. Okay, go to your MDM table, take the problem table side and identify it comes under which section. Undiagnosed new problem with uncertain prognosis comes under moderate. Okay, so in the problem table, you will get moderate. Then in the data table, just ordering of one USG is only mentioned. You can't take it as a low or a moderate. No criteria are satisfied. But go to next one, prescribed medication. Prescription of a medication comes under moderate. So since problem table you got moderate and risk table you got moderate, means you can take it as moderate. Okay, and here no evidence to tell that the lady is an established patient, so you can take it as a new patient. So new patient with the moderate MDM is 99204. 21. A 42-year-old patient came to office with a COPD with exacerbation. Physician discussed the patient condition with the pulmonologist for getting a better management. Quote the physician service. So what is the problem here? COPD with exacerbation. COPD means chronic obstructive pulmonary disease with the exacerbation. So chronic obstructive pulmonary disease is a chronic condition and now the patient is having its exacerbation. So chronic condition with exacerbation comes under which category? Moderate in the problem table. Okay, so problem table you get moderate. Then data table, what is the point? The physician discussed the condition with the pulmonologist. Okay, which means the physician have discussed the management option with another physician, means it is satisfied in the category 3 of moderate and high, but you can't take high because only one category is satisfied, so you can take it as moderate. Okay, so problem table moderate, data table moderate means final conclusion is moderate. Okay, since no evidence of established patient, you can take it as a new patient. So new patient with the MDM of moderate complexity 99204.